Hi, Mr. Jones.
Yes, sir.
What can I help you with today?
Well, Dr. Abdo, I'm having a problem because I keep snoring, and basically it's getting to a point where my throat hurts, and my wife is throwing me on the couch all the time. You know, I don't get a good night's sleep because of it, and she's telling me I better do something about it. So, you know, I basically do what I'm told with my wife. So I'm actually trying to be able to see if I can figure this out.
Absolutely.
Okay.
You know, it's a very common problem, and a lot of people come to me with this problem with snoring, and we try to help them. The main issue is to know if you have obstructive apnea or not, because a lot of people who have loud snoring end up being diagnosed with obstructive apnea, which is a very serious medical problem.
Okay.
It can lead to high blood pressure, to heart issues, to stroke. Diabetes have been linked to, you know,
my blood
obstructive
pressure is
sleep
a little
apnea.
high, doctor, actually.
Well,
just so that you know.
It could be related. So the first thing is to determine whether you have obstructive sleep apnea or not. So do you
Okay.
think you stop breathing at night, or do you wake up startled sometimes?
Honestly, she's the one that wakes me up. So no,
Okay.
I don't know. Maybe
So
if
not.
it happens, I don't know. To be honest with you.
Okay.
But you know, if I'm too loud, I'm kicked to the couch, which is
I know.
not a great way to run a marriage. You know what I mean?
Yes, yes. Do you wake up with morning headaches, or do you feel sleepy during the day?
I do feel sleepy. I do.
So-
Well, like fatigued. I try but I like fix it with like 5-hour energy, which I know is not the smart thing
Yeah.
to do. You know what I mean? It's just caffeine.
Definitely, you're a candidate to have a sleep study. And the best sleep studies are the ones done in a lab. There are some ways to test for sleep apnea at home, but they're not as accurate as having a sleep study, which is still the gold standard of diagnosing obstructive
Okay.
sleep apnea.
So you'd be
So-
referring me to a pulmonologist? Is that what it is?
There are several places in town who have sleep labs, and we will help you with that.
Okay.
Definitely.
So doctor, what are my options? And the reason I want to know this is that my wife is driving me nuts, and so I've got to get this fixed. And so, is there something in the office? Do I need to go to the sleep center you're talking about? And
Well,
you know, what are the implications, if you wouldn't mind sharing that with me?
absolutely. So, after the sleep study, if you have obstructive sleep apnea,
Mhm.
then the best treatment is using a CPAP machine.
Okay.
This is giving you positive airway pressure that will take care of the apnea part. And this will, at the same time, help with your snoring. Because of pushing air through the airway, those tissues that create that sound will be kind of splinted, so to speak, so you will not have the snoring.
Does it matter that I have a lot of allergies and stuff like that?
Now, this is where examining you, in a very detailed way, the nasal cavities, the throat, we use even a flexible scope that we pass through the nose after we numb the nose. It's a little bit uncomfortable, but there is not much pain. And this is part of the physical exam in the office.
Okay.
We look at the nasal cavity, if you have a septal deviation or large, what we call turbinates, which are ridges of bone in the nose covered with a fleshy membrane.
Okay.
If these are really thick, then this could be a problem with nasal breathing, and that has to be addressed. Also, we look at the soft palate, the uvula, your tonsils, the base of the tongue, even the epiglottis, which is a cartilage, part of the voice box. So all of these can be looked at and evaluated by using a flexible scope in the office, which is the first thing we do when we want to evaluate a patient for possible surgical treatments to help with snoring or apneas.
Okay. So there's potential surgical procedures that I might be having to do on top of doing the sleep study, is what you're saying.
Surgery is reserved as a last resort. And if you're having obstructive apnea, then the first line of treatment, and the best line of treatment so far that we know of, is the CPAP machine, as I told you, using those machines.
Sure.
If you do not have apneas, then if it's only snoring, then we can do certain procedures to help with the snoring. and we address the nasal cavity first, because people who can breathe through their nose usually stop having snoring.
Okay.
So if you have problem with a septal deviation or large turbinates or some polyps or some other pathologies, we deal with those first. And then if you're still having loud snoring, then we can address tissues in the pharynx in your throat, including the soft palate, the uvula, the tonsils, where we can remove them, and this will help also with the snoring tremendously. There have been very good results with that part of treatment.
Okay. So doctor, just one last thing is that my son, who's 8 years old, Ryan, actually also has problems with snoring. Is there options for him as well, or
Absolutely.
is this just for adults?
No, kids have same issues as adults with obstructive sleep apnea. If they don't get a good night's sleep and good oxygenation, they may have a lot of trouble with performance, with schooling. So it's a major problem in kids as well. And the good thing about kids, the anatomy that causes the obstructive apnea is much more understood and is straightforward. Usually they have large tonsils and large adenoids. And study after study, when you take the tonsils and adenoids, they really do well.
Oh.
More than 90% success rate, where you have resolution of their apnea and they do very well. So
Okay.
if you think they have trouble with sleeping, possibly apneas, I'll be happy to see them as well.
So you see kids as well?
Yes, I do. So
Okay.
we'll do it a family affair. Whenever you're ready,
Okay.
I'll be happy to see you both and your child.
Well, thank you very much, sir.
Absolutely.